So I kind of wanted to touch base with you. We've had now 5 full days, in an hour from now, 5 full days of the mass vaccination clinic at the Clark County Fairgrounds. Seems like everything has gone really smoothly out there. The logistics of things have moved along. I was shocked by the number that came out yesterday. 851, I think, was the number of vaccinations. So you guys have been able to overshoot even your most modest goals of daily vaccinations out there. Just give me your sense of kind of how that first week has gone.
Yeah, it's absolutely gone really well. I mean, this was a tremendous effort, obviously, a week or so to do this heavy lift and get coordinated with all the local partners and all of those pieces and work out all the kinks. So I think we're tremendously happy. I think we've learned a lot of lessons, but overall, I think the demand is there. And actually, we were able to set something up that went even smoother than our wildest dreams. Because, these types of massive events can have kinks along the way, but I think we're really showing that we can work through the demand and get people vaccinated, which is what they're so anxious about.
I know one of the biggest concerns, something that the governor had talked about yesterday, was the overall supply of vaccinations. We know that there's going to be some more coming in, but obviously we still have a long road ahead of us in terms of having enough that we can start really getting a lot of people in consistently. Is there any concern about a drop-off next week in terms of supply? Do you guys have any sense yet on whether you'll be able to keep up this volume?
Yeah, we definitely are committing the same amount of vaccine to the Clark County clinic next week, which I believe is just shy of 3,000 doses. And so that's ready to go. And so that's a consistent from this week. And we're hoping that maybe in a week or two, we'll have enough to up it even a little bit more. The problem statewide is demand is so extremely high. And we have such a large group of people who are ready and whose turn it is in line for the vaccine, but it's nevertheless not, we don't have enough vaccine to make everybody, it's your day in line to get vaccinated. And just to give some numbers before that, for next week, in Washington State, our first dose allocation is 107,000 doses. So that is a 16% increase over what we had this week. So that's good news, but it still is only 107,000 doses. So the providers told us that for next week, they could use 358,000 first doses of vaccine. And so we're not even getting, it's less than a third. The demand, our what we're getting, our allocation is less than a third of what the demand is. So we have a long way to go to have enough of an allocation. And in fact, if we had that whole 358,000 doses of vaccine, what providers are telling us is what they want to use next week. That's over 50,000 doses per day in our state, which would blow away our goal of 45,000 doses per day given. So the demand is there. We are waiting for supply to catch up with that. And it sounds like the Biden administration is trying to do a lot of different things to get that moving quicker. And I think we're on the verge of seeing a couple of different vaccines being ready to seek FDA authorization, and a couple more new vaccines. And if they do that and they can meet the FDA authorization requirements, we're going to have better supply.
The scheduling situation obviously was a little bit of stressful for some people.
Yeah.
I've heard from providers, I've heard from the county and Department of Health, obviously, that this multi-pronged approach to having people register at multiple places is not something we want to see going forward. We'd like to have a single portal. Can you talk at all about the efforts there? And then also, I know, the governor had mentioned yesterday, and there'd been a Department of Health release about people from Oregon coming over. At the front end, is there any explanation or exploration, I should say, of sort of a registration system that could maybe have residency requirements built in or proof of residency built in at that front end before people show up?
Yeah, so we definitely want to get to, I think this was one of the, kinks we had to work out, or one of the challenges. We want one way for people to register. And when we were just standing up things so quickly, there was a lot of just, confusion and discussion about which tool. And so, yes, it will be one way to register going forward. And obviously, we'll be able to release that information to the public more quickly than we did with this stand up of a new event for the first time. That part. So, we are looking about what kind of double checks do we need to have in the system. But anybody who lives or works in Washington is eligible for vaccine, and you may not always have an in-state address. So that's one of the tensions, right? Obviously, it was not okay to have anybody coming from out of the other state to just vaccine shop for a day, come across the border and do it. But we do have people who work across state lines both ways. And who are eligible for vaccine. And we do have people who are working in Washington who we want to have vaccinated because they're and they may be here temporarily. So like our farm worker community or others like that who may be in the state for a temporary basis aren't eligible for vaccine, and they're part of who we need to help bring community protection. So we're trying to balance all those pieces. And so what's the right way to document that? So that's why we've asked for either proof of address or an ID, but it may be other things, cell phone bill or maybe a work ID to really show that you are working in our state if you don't have proof of address.
So, I think the main takeaway there is it's still a work in progress. The goal initially was just let's get this set up, let's get it going, let's get people in line, and let's start getting shots in arms. We can take care of some of these other frustrations as we go forward.
Absolutely. And it's very clear. Like if you do not live or work in Washington, we do not have vaccine for you. We do not have enough supply. And, it is hard when there's, our border communities and slightly different vaccination strategies across the state line, since those are state decisions. But, our job is to get the limited amount of vaccine we have to people who live or work in Washington.
Lastly, the governor mentioned yesterday that you had reached about 40,000 vaccines a day or vaccinations a day. I would assume, just based on math from what you said of how much you're getting, that was more a case of some supply that had been held back in some places for people for phase 1A being released into the phase 1B tier 1. Is it your guess that next week that number might come down a little bit per day until the supply increases?
Yeah, that's actually doses. That's actually doses reported to the state each day. And some of that actually is catch up on doses that there had been a reporting lag on. So we've seen this. So it is more vaccines being given per day, but it's also this catching up on reporting to the state because there was a delay in reporting. And so we do expect some of that to come down, right, as all the doses that hadn't been reported are coming into the state. So if you remember a few weeks ago, or even actually really just like a week and a half or 2 weeks ago, when you would look at our data and you would see like only like 20% of the doses that the state had been allocated had been given. But as we talked to providers, they were saying, we've actually given a good portion of those doses, but they hadn't reported to the state yet. And that's because the data is in a lot of disparate systems, and there's lots of on the ground logistical barriers. So we've been working really hard at our end to support providers to make sure they're reporting every day, remove any technology barriers for that. Same thing for the provider community. They're working hard to get any technology barriers to get those systems up and running so that every day we're getting an accurate reporting on the number of doses given in our state.
Yeah, it's steady improvement, and I think that you guys have been good about trying to stay on top of that. In terms of scheduling out for next week, do you guys have any sense yet of when you might be able to open some of those appointments up?
I don't know the exact day, but I know that is the intention to do any moment now. So I'm sure if you emailed the Shelby or the PIO desk back, I think they'll probably have that exact answer for you. Obviously, we're hoping it's not Sunday night or right before it's due. More time. So I think you'll see it hopefully in the next day or so, but they're going to have that exact answer.
Okay, great. Michele, a last chance for you to say anything else that you wanted to add before I let you go.
Yeah, I'll just say we just appreciate everybody's patience. We know we're all tired of this pandemic and really ready to have vaccine and to help make sure we're better protected. It's going to take time, so we appreciate people's patience. And in the meantime, there's other things you can do to protect yourself from COVID. And those are some of the things we've been doing all along. Wearing your mask, watching your distance, and washing your hands. So those things couldn't be any less important now, even though we started getting some vaccine into our communities.
Right. Well, I appreciate you taking a few minutes to talk with us. Have hopefully a little chance to relax this weekend, maybe.
Yeah, I hope so. But I'll relax once everybody has vaccine, right?
Great. Well, thank you, Michele, again. Appreciate it.
Okay, take care.